What's coming? Hi, Tommy. So, welcome to tonight's podcast. Really pleased you're able to join us. Can you introduce yourself, please, and share your journey into clinical oncology?
Okay, hi, I'm Tommy. I'm a doctor. I'm currently working as a clinical oncology registrar in South London. And I became a clinical oncologist after doing about 6 years medical school. And I did 2 years what we call foundation training, which is the first few years of being a doctor. And I did a bit of medical training and I wasn't sure what to do. And an oncologist came up to me and they're like, "You'll be a great oncologist." And I was like, "What? Me? No." And then after some thinking, some experience, and some praying, I finally came up with the plan to be a clinical oncologist. And here I am now.
What an amazing story. To somebody else, sometimes people see something in you that you can't see yourself. So they've obviously picked up something from either what you did, from your character, from your caring, um, and obviously what they know about oncology to be able to recommend you into that field. So, well done to you.
And
Lovely to
my my claim to fame is that even in my interview, one of the comments is that you should probably read more about oncology, but you'll be a great oncologist. And I was like, thanks.
and I'm sure there's so many things that are changing all the time. So it was your destiny. So that's
Yes.
brilliant. So what is a clinical oncologist? Explain that to us, please, to our
So, a
listeners.
clinical oncologist is a cancer doctor who can give both chemotherapy and radiotherapy. I have this running joke that I'm like, get you a girl who can do both. But yes, we do both clinical, we do both chemotherapy and radiotherapy. That's the main difference between us and medical oncologists.
Okay. And which one do you do more of, if I can ask?
So actually it varies. Because we are trained to do both, we can do all tumor groups. We often all get some opportunities to do some radiotherapy during the week. But I'd probably say we probably do more chemotherapy than radiotherapy, but very much depends on the tumor group that you're covering at the time.
Okay. And tell us you've got some people that are listening that may not know what a tumor is and what a tumor group is. Just unpack that a
So
little bit.
a tumor group refers to an area where the cancer is based. So you might have a oncology doctor that's like does maybe prostate cancer or does a bladder cancer or does breast cancer, or you might have a doctor who might do all kinds of cancers in a specific area. So all kinds of like male cancers or all kind of female cancers. It varies.
Wow, okay, it's really helpful. Thank you. So over the years, what have been some of the biggest changes you've seen in cancer care?
Probably one of the biggest changes that I have probably seen and heard about in cancer care is how precise cancer care is becoming. So I've been training in oncology since 2021. So there are certain things that I see on a day-to-day basis that people often like to remind me is actually new, but it doesn't feel new to me because I just started with it. But then there's a significant developments in like what we call precision medicine, which essentially people are looking at the tumor, like after you've taken a sample of the tumor or the cancer, and they're looking at it under microscope, doing specific tests, and then catering medication to specifically target that cancer in a way that has never been done before. And that's resulted in much better outcomes for lots of patients and lots of more treatment options. So I think that's probably the biggest advancement that I've seen in cancer care overall. If I was to be specific about clinical oncology, so I do radiotherapy, once again, it's a bit more about being precise again. So now there's this emergence of a type of radiotherapy, which is like radiosurgery, where they're allowed to give radiotherapy to very large amounts of radiotherapy to very, very small areas, which means that areas of the body that maybe weren't treated before, or patients who maybe wouldn't have been eligible for curative treatment now have those options. So it's all exciting.
Yeah, sounds it. And the outcomes you just said as well, I mean, improving outcomes, which everybody wants to see. So that's really, really good news. And it's nice to be a part of the system where you're witnessing it. You're saying you're coming in at your stage, but people are saying it's new. So it's obviously it's great news. Well, brilliant. Do people talk openly, do you think, about their cancer? Um, or do most people keep it private? I know you're in a medical setting, so I'm just wondering what your experience is of
So it's
people
very
wanting to
varied.
share.
It's extremely varied. I think looking at the complete patient cohort that I tend to come across is very varied, and sometimes you can see certain cultural variations, and sometimes you can see this personal preference. One of the things that I see very commonly is that people who are usually caretakers or the strong friend or the strong person within their community tend not to want to share their cancer diagnosis, or they tend not to share it with people that would worry about them because they want to continue as normal. That's very common. But another thing that I've definitely seen is people not talking much about their cancer diagnosis within Black communities within the UK. And I think that's often associated with a perceived stigma around cancer. So both in at work, I see it all the time, and definitely personally, I see it all the time. In fact, I've started social media called Oncology Bestie, and it's all about normalizing conversations around cancer. And I've got family members that are like, they don't want to like any of my posts because they're like, why are you talking about cancer? And I'm like, I'm an oncologist. That's what I know. But it's that extreme that even just me talking about cancer is controversial enough that people are like, oh, like, why are you doing that? What's going on? So there's huge, huge, huge perceived stigma around cancers, and I'm super passionate about just normalizing conversations about it, just because there are lots of other conditions that actually people feel quite comfortable talking about that have similar outcomes to cancer, and I'm just trying to overcome the stigma and all of the secrecy around the cancers that people may experience at some point in lifetime. So I think I saw a statistic that says something like 1 in 4 people across their whole lifetime may be may experience having cancer. So we need, unless we keep having these conversations, we're going to struggle to get far with regards to making people more aware of what they need to look out for and the treatment options available. So, yeah.
It's really interesting what you just said. So there are other conditions that have similar outcomes. People are more comfortable talking about those. They won't talk about, and that's the fear, isn't it? From years gone by, people are still fearful, although the landscape is changing. So that in the past, you know, the C word, and it's no longer a death sentence for many because you just said you've got emerging new treatments and different processes. Also, I read somewhere, which is really interesting. I can't remember where I read it or heard it. Um, Loneliness is as bad as it's so chronic what it can do to your body. It's as bad as smoking X amount of cigarettes a day. I can't remember where I heard that saying from,
I
but
think I've done that before, yeah.
yeah, loneliness. You just think loneliness kill you, but that's what it was saying. It's as bad. You can get ill. You can get um obviously it's a mental health state of mental health as well, isn't it? That can turn into physical ill health as well. So well done on your channel that's allowing people to open up. And you're right, there's a certain group of people on social media who will openly talk about it, and that's what they do. They made a point of doing it. And some will be like the silent followers who will read it and they'll come back and maybe save it. And they're the ones that, really need to hear it. And you probably never know who those people are, but at least there are people that are keeping your page going and watching it. So yeah, well done to you. So
Thank you.
just got a couple of just a few more questions as we go through. Um, what do you think influences someone um to feel more comfortable about sharing their diagnosis? As if they hear somebody else is going through something similar. do you think would make them feel more comfortable?
So I think it depends on the reason why they might have chosen to share it. I think there are some people that are just extremely open and are quite happy to ask for help and recognize the fact that quite often going through something like having cancer or any other medical problem, you're going to need help from other people, and the only way you're going to get help is if you talk about it. I think sometimes actually realizing that cancer is more common than people think also can sometimes help people feel more comfortable speaking about it. I find that sometimes people knowing the benefits of speaking up um, can sometimes help. So I think I've spoken about this before that actually, when you talk about cancer, not only because someone experiences cancer, but also talking about cancer more generally, it means that people are more likely to look out for the symptoms and go to GP earlier if they have any symptoms. It means that people are more likely to know if they have a family history of cancer, and they're more likely to be able to engage with healthcare services to get the extra surveillance or the extra kind of tests that they need to just continue to check if they have cancer. The more that people talk about it, the more opportunities for people to not feel alone, the more opportunities to work towards equity, like having equal access to cancer care, or getting equal access to opportunities for trials. Like there's so many benefits from sharing experiences with cancer, sharing cancer that might be in the family, or just talking about cancer in general. That sometimes that empowers people who maybe would ordinarily be more reserved to actually be like, this is what's going on, and I want you as well to come and join me in talking about it. So there are lots of reasons why people might join.
Yeah, I want to do that. And is there any particular experience that's shaped how you practice oncology today? Has anything happened or
Yes,
anything that's
I think probably one of the things that shapes how I practice as an oncologist actually happened even before I knew I wanted to be an oncologist when I was a medical student, actually. So when I used to go on the GP placements, we would sometimes have the opportunity to go to patients' houses. And I went to the house of a lady who had MS. And she was talking about her experience, talking about her condition. And she said one day she went to the hospital and because her disease got a bit worse. And the hospital had a big meeting about how they were going to help her. And they went and they put a hospital bed in her living room. And she was like, that was the worst thing that ever happened to her because it meant that her husband went from being her husband to a carer because they were no longer able to share the bed. And I can remember in that moment, I don't know what came over me. I just burst out crying. She was like trying to like like comfort me. But I think it just showed me and it stayed with me since that how what can happen when we don't involve patients in our decision making. And as a whole, and as much as possible, and I'm not perfect, I try to be as transparent with patients. I try to involve them in every single decision. I try not to make any assumptions. I try to be as inquisitive as possible to make sure that when we are all gathering and making decisions about people's care, that they are actually the decisions that people want. And I think that that's definitely shaped how I practice as an oncologist in so many ways. Now, so many, because I do research looking at some of the reasons how people make decisions about their treatment. And so been fortunate enough to have so many conversations with people about their experience of cancer care and what could be better and how we can better support. But I think that experience has probably shaped who I am as a doctor in general.
yes, that was quite sounds quite emotional as well. And we always think we know best and we give advice and we do this and do that. And just listen to how people are thinking and her response, whilst we thought we did they did a good job, it was received completely differently. And I can imagine.
A normal X-ray machine, but we basically get the technology that's used to make the X-rays and we make it super, super high energy. And then we target it towards the cancer with the intention of either getting rid of the cancer or reducing the risk of the cancer coming back, or just controlling symptoms from the cancer. So the way it usually works is that someone will come in for a CT scan, which is basically one of the scans that looks like a donut. If you've had one, you'll know what I'm talking about. And then we usually give someone a tattoo so that we can make sure that they're in the right place each time they have some treatment. And then as a clinical oncologist, I will then draw out where I want the radiotherapy to go on the CT scan that's been produced. Then someone will have some physicists who do some fancy physics work and mathematics to make sure everything is safe. And then usually people come back for treatment. So it's essentially a way of using some of the x-rays that we use to treat cancer. And that's usually the process that it looks like.
Wow, thank you for explaining it so simply. But so I'm just, as you're talking, I'm just visualizing it. And it is complicated, isn't it, really? But yeah, thanks for simplifying it for us. So are there any common myths or misconceptions people have about radiation? And I'm going to talk about hair loss because obviously I'm a trichologist. So what does that how does it affect the hair on the scalp or on the body?
Yeah, so what it does exactly to the hair depends on the dose that we're giving. So the amount, and it depends on where we're giving it. So generally, any amount of radiotherapy that we typically give will cause some hair loss in a specific area, usually temporarily. So one of the biggest misconceptions is that it will cause hair loss on the head automatically. Radiotherapy only causes hair loss in the area that we are treating, right? So if someone is having radiotherapy on their breast, it will only cause hair loss in the breast. If they're having radiotherapy in their pelvis, in like the groin kind of area, it would only cause hair loss there. That's the first thing. So the only time that people ever get hair loss from radiotherapy is if they're having radiotherapy to the head. And even the extent of the hair loss that you might get from the head from radiotherapy depends on where we're treating. So there are patients who have brain cancer that can receive radiotherapy and they only get hair loss in the specific area that we are treating. And most people actually, they just cover up with the rest of their hair. The only time that people tend to see hair loss all over from radiotherapy on the head is if we're treating the whole brain. And that's very, very rare. We don't do that very often. So that's probably the first misconception. The second misconception is that all radiotherapy hair loss will never grow back. That's also incorrect. So the vast majority of the doses of radiotherapy we give, usually we expect the hair to grow back. It does take some time, but it does typically grow back within weeks to months. And yeah, it's only if we have extremely high doses of radiotherapy that it won't grow back. But we usually give you the heads up about that if that's the case.
Excellent. And how do you support them for the patients who are anxious about the visible changes to to their scalp, to their skin burns and things? How do you support them?
Yeah, so we have a huge team within the radiotherapy department that are dedicated towards making sure that the radiotherapy experience is as comfortable as possible. And I think that's one of the things that if you ever said, Tommy, what's your biggest bugbear? It's people thinking that by asking me a question about how to make themselves more comfortable, they're bothering me. And I always have to remind my patients, I'm like, it's my job to worry about you. And quite often people will have all these worries and have all these concerns and have all these side effects and suffer in silence at home. And I'm like, I'm here,
Oh,
I'm
wow.
here, just ask. So,
Yeah.
and I think the thing about radiotherapy is that each radiotherapy machine is actually quite expensive and it's not easy. You can't just plonk a random radiotherapy machine and expect it to work. That it has to be in specific areas. As a result, there's very few radiotherapy centers in the country. And as a result of that, not very many people know how to manage what we call radiotherapy toxicities or what we like side effects from radiotherapy. So it's always best to go back to the team that is treating you or treating like whoever's having the radiotherapy to ask them specifically for how to treat it because they have the specific knowledge. Most your local pharmacist isn't going to know much. Your local GP isn't, like, they know lots of things, but they can't know everything. And we're the ones who are the specialists, so people should come back to us. With regards to skincare, usually what we advise is that people moisturize as much as possible. Moisturizing is really, really important. You have to be careful about the moisturizer you use because actually the radiotherapy can interact with some metals like zinc in moisturizers. So usually your local center will recommend the moisturizer that is good for you, but essentially you want to kind of keep your moisturizer as simple as possible and use it as liberally as you can. The next thing that you want to think about with radiotherapy is reminding yourself that actually radiotherapy works for 3 to 6 months after you finish your treatment. So as a result of that, the need to moisturize more and all the advice that's given around radiotherapy is something you have to be mindful of for up to 6 months afterwards. Sunscreen is really important when protecting the skin after radiotherapy, just because the sun can interact with the radiotherapy. From a hair perspective, the most important thing is depending on with the scalp, from a shampoo perspective, you want to keep simple shampoos. You don't want to be using anything with sulfate. You don't want to be doing anything that's like high manipulation hairstyles or things like that, because that's going to make the whole process a bit more uncomfortable and take a bit longer to recover from. And then the last thing with the hair aspect is just be patient. So the hair does grow back in most cases. There are some cases the hair doesn't grow back, but for the majority of the time, the hair does grow back, but it takes months for it to grow back fully. And it might not grow back in the same way. But if you just stay in contact with your local team, and we can refer you to a trichologist or a dermatologist if needed.
Excellent. That's a really good answer. It's really helpful. Thank you. And what developments in oncology um, give you hope for reducing, side effects like hair loss or skin conditions? Any?
Well, one of the things that's amazing about all the advancements in oncology is that people are living for longer. And we are coming to the realization that actually there is life outside of cancer. And as a result, there's this growing kind of branch of medicine called supportive oncology, which is where people are getting clinicians in super early to kind of handle and manage all of the anticipated side effects of chemotherapy and radiotherapy, not only during treatment, but much after treatment. And I'm really hopeful that we could be getting trichologists or dermatologists involved in supportive oncology, because we know that both chemotherapy and radiotherapy do have effects on people's skin and people's hair. And if we get people involved and get people within the system sooner rather than later, I would anticipate that there would only be better outcomes. And we might even be getting more innovations in regard to because I think the main thing we use at the moment for chemotherapy is cold cap, which is very effective, but then doesn't work for everyone. And I think because it's almost like there's been so much focus on just trying to get people through cancer treatment, that I hope that now that people are living longer and having much better outcomes, that we can start to think about life beyond that and start to put a bit of money behind research into other options to try and minimize hair loss or make hair recovery as quick as possible.
Brilliant. Yes, I know the firm very well, Paxman, and that helps with chemotherapy, doesn't with the scalp cooling. And they've
Yes,
done some recent research as well, which is which is just fantastic. It's
yes.
brilliant. Thanks so much. If you could share just one message directly with anyone going through cancer treatment right now, what would it be?
You're not alone. Not only is there probably more people around you who would love to help you if you give them the opportunity, there's also a whole team of clinical staff, whether it's doctors, radiographers, nurses, care support workers, pharmacists, so many people that are super happy and keen to help you. There's so many charities that are super happy and keen to help you. And there are so many other people who have either experienced going through cancer, survived and are thriving after cancer, or who have looked after someone who has gone through cancer, who is so happy to help. And I think that's what's so beautiful about the world that we're living in now, is that there's so much help everywhere. So please, please, please don't sit in isolation. Just remember you're not alone.
Brilliant. And could you just tell the listeners where they can find you again? You mentioned earlier if they wanted to, follow you online, where can we find you?
Yeah, so Dr. Tommy, Oncology Bestie is my handle. I'm on TikTok, I'm on Instagram, I'm on YouTube, and it's all about normalizing conversations about cancer. So comment, like, subscribe.
Oh, that's excellent. I'm so pleased I've met you actually. First spoke at the C&Hair conference a couple of years ago, and you were just so interesting then. So pleased that you've been able to make the time to spend with us this evening. Thank you so much and have a good evening. Thank
Thank you
you.
for having me. Thank you.
All the
Bye.
very best. Thank you. Okay, goodbye. Goodbye.